Ladies and gentlemen, let's get ready to rumble! Get ready to rumble!
Pump up the jig, yo, pump it up, yo, pump it.
Welcome back to TalkingSports.tv. That's where it's live and interactive, and I'm very excited right now to bring on a couple of new guests. Naughty Nikki, you know these guys. I mean, they're two superstars in the field of concussions, and we're going to get a little more serious right now after Howard came in and Lawrence Morgenstern. We're going to talk about something that's really become prevalent in professional sports, and that's concussions. And with us, you can do this.
Oh,
you can
okay.
do
Well,
this.
we've got Dr. Stuart Greenspan and
Kerry Goulet.
Kerry
Goulet.
Goulet
I said you could do it, but I'm interrupting.
Oh, of course you are.
It's
That's
a
kind of
beer.
what you do.
Yeah, it's
Exactly.
a beer.
But just blame it on the beer, right? No, you know what? You guys are doing some really great work, and you know, Marty says that it's a big concern. I would say that it's an epidemic.
Yes.
I mean, tell us a little bit about your organization, Stop Concussions, and what you guys are doing.
Well, first, thank you very much for allowing us this platform. Stop Concussions was formed by a former captain of the Philadelphia Flyers, a 15-year veteran, Keith Primo, who had a career-ending concussion back in 2006. He and I got together. We were working on spinal cord injuries in hockey, and when Keith went down with his fourth career-ending concussion, we decided as players we need to do something about it. I personally suffered from a concussion in 1990, and we knew that this was not only a situation in sport, but in all walks of life. So Keith and I wanted to be the athletes from an inside-out approach, rather than just having all the doctors decide what was going to go on. We've got a very good one here. We wanted to help the doctors and our medical world understand a perspective from the athlete and help teach the cause, effect, and consequences of concussions to parents, trainers, coaches, and of course the players themselves.
Kerry played 16 seasons of professional hockey in Europe. He was highly ranked, one of the top players in this country at one time. And Dr. Stuart Greenspan, who's coming back to join us yet again, has spent a lot of time investigating concussions, working on trying to help the situation. And I'm going to say, Dr. Greenspan, you've never seen me like this right now, have you?
No, concussions and alcoholism are totally different things.
There's no correlation
Well,
at
you know what,
all.
for our audience, why don't you tell us a little bit about exactly what happens when someone gets a concussion and
Part
why
of
it's
that,
such
I'd
a
like to
big deal?
compliment Kerry and his team on the work that they're doing, because if you could explain what baseline testing is, because I was a trainer for many years in the GTHL with the younger children and stuff, and you have a child who has sustained a concussion and you're not sure exactly how severe that is cognitively, and there's no reference point as to, you know, could the boy add or count backwards from 99 prior to the accident?
Exactly.
So what his team's done, if you could go forward and just explain to everybody what a baseline testing is and why that's so important in getting a foundation as to what's going on.
Well, number one, I want to thank you for that, because it's a very, very serious situation, because there's a lot of controversy in it. Of course, you know yourself.
Absolutely.
Even in the medical world, we really, because you can't touch it, see it, or smell it, we don't understand it. We all look for the magic instant fix. We want a pill, we want a Band-Aid, we want equipment or rule changes. But realistically, we have to understand, we have to educate ourselves. Before we do anything, we've got to change the mindset that was inside the mind. And when it comes to that, we have to protect, as you know, athletes, we have to protect ourselves from ourselves. And you, off camera, was telling me about, we have to almost protect them from their parents. So what we did is, Keith and I went around North America and basically started to talk to doctors, and it's going to take all disciplines. It's not just neurologists, it's not just neuropsychologists, but we're going to need all disciplines: chiropractors, osteopaths, athletic trainers, kinesiologists, to come together and work together at this. You can go to any ER hospital in this city right now, and you could get 5 different diagnosis of a concussion and what to do about it. So we decided that we needed to go with a new baseline. Baseline is where you actually measure the brain. And for a doctor, it's going to help them tremendously if you know. Think about it. You don't jump in your car and just drive down the street. You get a roadmap. So what we want to do is have a roadmap of that brain. So prior to the season, we want every kid, every person to to have a baseline. That's good for us too. Let's say we fall down the stairs. Let's say we get into a car accident. But for the athlete, what we want to do is basically take that brain and have some sort of a roadmap that allows the medical world to understand where the brain was prior to an accident. So we know that Sidney Crosby went through what's called impact testing. That's a cognitive test that's sold all across this country that you can buy for your child, and you can go home and do it on a computer, which gives you a cognitive reading of the brain. And then you can take that reading and bring it to any medical doctor, and they can see where your brain is. The problem is
comparing it against the,
absolutely.
So yeah, let's talk about exactly what baseline means, because my background is psychology and neuroscience,
right.
So I've done some
Yeah,
testing,
what they're
but
doing is they're trying to find out, Mr. X gets an injury. When is, people come into me and say, is my son ready to play again? I'm like, whoa, like where do I draw that line?
Yeah.
And it's a scary one. You don't want to send a kid back when they're not prepared to go, and you don't want to send them to be further injured if they're not ready. But the baseline testing is really important because you get an idea of this person is very good in math at this level, this person's cognitive reading and comprehensions at this, their physical capacity is at this level, they could do 20 sit-ups, this and that at that level. And following the concussion, you go, my goodness, this guy's math has dropped 3 grades, this guy's this has dropped. And you can see when you get back up to the level where they were prior to the injury, okay, now we're ready to induce some basic activity and see if their symptoms start reoccurring, and then light practice, and then increase those activities up until. So this way, it's no longer guesswork for the doctor. It's been 4 weeks. Try it, son.
And if I could add to that, and Dr. Greenspan has explained it very, very well in layman's terms, because that's what we need to do. We're dealing with people that need to understand it, so we need the parents to understand it, not just in a medical term. What's really important about what we just talked about is the brain. That's only one part of it. It's only what's called cognitive. Sidney Crosby, when he ran into Kootenitz, he could pass his impact test. His it wasn't a cognitive problem, there were other problems. So what we've developed now is a whole array of tests before the season: cognitive, balance, motor skills. It's one thing to be able to think properly, but all of a sudden when you're on the ice and you have all these objects coming at you, it heightens the intensity of the brain and functioning, escalates the heart rate. Then what happens? Then you get back into symptoms. So what we need to do before we allow our children, this is not a broken leg, it's not a broken arm, this is a broken brain. So before we take the risk of putting that player back on the field or back onto the ice, let's make sure that the medical world has the best information about that brain before we allow them to go back out, because I'm not sure if you've seen it or you've seen it. Second impact syndrome, where you see these young boys or girls getting hit when their brain is already damaged, and these brains swell. And we've lost a young boy, his name's Eric Pell, 18 years old, 3 years ago, to second impact syndrome because we did not manage it. We're the adults. Let's make sure we take care of our future brains.
That's the thing. Like you said, you need to have different tests because different parts of the brain are responsible for different things. Sidney Crosby, his concussion was localized in the vestibular area, which handles your balance, whereas a concussion in the prefrontal cortex would be more likely to affect your cognitive skills. So let's talk about what we can do. We understand what the problem is. We know how we can start measuring it. What can we do to stop this? Are we talking equipment, rule change, culture change? What do we have to do to stop kids from getting concussed like this?
Well, again, you're looking at a car. I buy a car. How's my car not going to break down? Well, I check the brakes, I check the motor, I check the engine. You got kids that, separate their shoulder, puts a lot of stress on the head, neck, and jaw. Whenever how many guys in hockey get a separated shoulder, minor strain, all the time. It will immediately spasm the upper trapezius. The upper trapezius spasms start pulling on the neck. It immediately throws your vestibular system off. There's so many different things that the individual, let's say someone sleeps on their stomach with their head turned and their arm up like this, like that all day. Do you think that helps your vestibular system? Absolutely not. Then they get hit and boom. And then they, sitting in a room and resting doesn't straighten out those problems, doesn't balance out those things. You talk about muscle testing, is this working? Is this working? Is that working? You got people educated in how to balance and reset this thing, this ball in the middle of the room. I always tell people, and there's a string that corner, that corner, that corner, that corner, this corner. If I cut this string, that ball shifted. You got to know how to bring that ball back to the middle and restore and bring back things. And
you've brought people back. You've done it.
I do quite frequently.
How do you do it?
Again, it's starting from the foot, how the pelvis is level, how the head's level, how they breathe, if the jaw's level. Anybody who takes an impact to head, neck, and shoulder, it comes out the jaw. Whiplash in a car, whiplash in a thing. The jaw swings like a little hinge in your head, and anything decreases the vertical dimension. Now shut off all your power on that side. There's ways to go back and level these things, reset these things, and reset them back to zero, and then the person does better. Sitting in a dark room is the most ridiculous thing I've ever heard in my life. It's just like 20 years ago, you read these books by these doctors that were geniuses and it said bed rest for disc herniation.
Yeah.
Now it's on the bottom of the list.
Yeah.
Somebody has surgery, they don't lie in a dark room. They get them out of bed, circulation. The biggest thing to heal in medicine, all my machines I spent a fortune on, every one of them does one thing. Increase blood circulation to an area. All your healing agents. I keep telling people there's a car accident here and there's a road block to get there. We need things that come, clean up the injury, and then bring in fresh blood circulation and healing. All in the head. Lots of these things are damage to the skin, to the skull, to the jaw. And when you just sit there and you just put a guy in a room, it's totally ridiculous. Yep. Nobody's getting better. I take people individually and we test from A to Z, much like the cognitive testing, but in the physical testing, and we see what went wrong, what happened, what was the mechanism of injury, and we try to reverse that. And we reverse it and bring it back to zero, and then you can build up and build the strength back up, and then you have somebody willing to do something.
Tell us a little bit about prevention in addition to treatment.
This is really important because
this
is the new wave. This is the new thinking. We're taking it out of the box. The Zurich consensus in 2009 basically said, you get a concussion, rest. What does rest mean? We don't even know what it means. Don't look at a TV. Don't look at it. What about the other psychological components that come to a young boy? All of a sudden you say, for the next 3 weeks, you're in darkness. So there's also a psychological. And I think the most important thing that you mentioned is prevention. Prevention is education. What we need to understand is the brain moves what's inside the skull. A mouth guard, a helmet is not going to stop that brain from moving. So what's really important is, first, let's understand that. Let's not be afraid of it. Let's understand that. And so let's understand that now we take that brain, and if I took our buddy's head and pounded it against the wall, the brain would move. If I took 6 inches of foam and did the exact same motion, the brain is still going to move. Now all of a sudden, I hit him on a rotational situation.
I'm taking a beating here.
The worst. So what we need to say is, let's not worry about the cause. Let's worry about the accountability of what we're doing with our bodies and understand. Let's teach these young boys and girls how to play with contact, because we know everybody's up in arms. Let's take hitting out of the game, checking out of the game. Let's have non-contact. For God's sakes, when I was 3 in a kindergarten, there was contact. Let's learn how to give and receive contact. It doesn't necessarily mean checking, but that's the part of the prevention. We need to get back, break it down into Lego. Let's go back. Let's stop teaching old skills to new school participants.
Old skills.
Old skills.
Like what?
Well, the old skills right now is that this mentality of, being a gladiator. You can see from my face, I played pretty hard in my day. The problem is I also played stupid. Let's stop playing stupid. Let's take the Matt Cooks hits out of the game. There's no place for it. Let's take this last one, I think, with Sedin.
Duncan Keith.
Yeah,
Keith.
Duncan Keith. Great hockey
The
player.
elbow.
There's no need for
Dirty,
that.
dirty play.
Let's take that in. And that what we have to do is take the attitude out of this. Mike Milbury.
Yeah.
What in the heck is he talking about? Arguably the best player in the world. He's accepting that we goon and call him a punk because the way he plays. My God.
The only thing I'm sorry about Mike Milbury is that I'm not an NHL GM, so I could rake all his players for nothing.
He's a former coach too. Let's be honest. Don Cherry advocates that kind of mentality.
Well, you know what? Don Cherry's got a lot to say, and he was really critical of the enforcers that came out later and said things like fighting in hockey can be really bad and really damaging to the brain. You know what? Here's a statistic: 95% of prisoners in maximum security prisons have evidence of traumatic brain injuries, TBI, usually in the prefrontal cortex where impulse control normally happens, and that's why they can't control their impulses and they just freak out.
Right.
That type of thing's happening in hockey all the time.
Too much.
You know
Let's
what?
look right now.
Maybe some people don't like this perspective, but I don't think that fighting adds anything to the game anymore. I think that's something that's got to go. I think that there are other ways to make sure that players aren't taking advantage of each other.
Absolutely.
Let's stop beating each other up like gladiators and get back to playing the game.
Agreed.
Well, look at a big guy. Yeah, exactly. Look at a big guy like Colton Orr. What is he, 240 pounds?
Yeah.
He gets punched by another guy 240 pounds in the face, and he's got all types of headaches and concussion-like symptoms from that. These guys are fighters now. They're not just guys who had a dispute in the ice and had a spontaneous. These guys are training, they're fighting, they're boxing. But if we get away from that for a second, we're talking about prevention. You're talking about the younger kids. Mouth guards are important for the younger kids. They can't just bite down on mouth guard wrong. It throws all the body's coordination out. And you can't wear your head you know, they got their chin protector
Yep.
sitting right on their chin, and you touch their helmet, it goes right through the jaw. The jaw is one of the most sensitive things in the body for bounce. If you look at your boxers, the only way you knock out a boxer is hit them right on the clock, them right on the jaw. And these guys have their jaw like this, and I bump them right in the chin, and just knocks their jaw right out. So fitting the equipment properly.
Very
like
important.
when my son was playing AAA, at 15 years old, he got his helmet. His cage was a full size too small. It put it on his face. He couldn't even barely get it. It was a crunch in his face, and a bunch of kids on the team were wearing it like that. I go, no way. I took it off, and I got it fitted properly. Now, guys that wear that are having an accident, and you're putting your kids in harm's way for no reason. So
I know we're going to wrap up. I just want to make one very important, because what you brought up is really crucial. We have to realize right now, with statistics, it can all be skewed, but one of the statistics that I just got from the Ontario Brain Injury Association is that brain injury, whether it's acute or acquired brain injuries or through concussions, have an 8-time greater effect on our economy than breast cancer, than any types of the cancers. So we have to take this very, very serious, and we have to do something about it now. And I can't thank you enough for doing what you're doing with us.
And this is serious stuff. It's a far cry from some of the stuff we were doing earlier on this show. It is really serious stuff. Kerry Goulet, Director of Stop Concussion, thank you very much. Is there an email address that people can contact you at?
If you go to stopconcussions.com, all the information's there, and I'm personally available at all times at Goulet29 at stopconcussions.com. If you have any questions, anything you need to know, you as a parent, you as a player, you can reach me at 24/7.
And we'd be remiss if I didn't mention that one of your other co-activists is Ron Ellis, who was my favorite player as a kid, born on the same day.
Yeah, he's a fantastic, and won a Stanley Cup in '67. But another guy you're going to introduce right now, Paul Rosen, has been fantastic. 9 concussions himself, and he's one of our ambassadors. Can't find a better person than him.
And Dr. Stuart Greenspan, who must be the best chiropractor in Canada, because he certainly helps me a lot.
Yeah.
And he's a tremendous person and an outstanding concussion expert.
Absolutely.
And the fact that he helps my back all the time, I really thank you for that too.
Guys, thanks for coming on the show. This is really important, and I'm glad we had a chance to get the message out. Thanks for all you do.
We'll be right back with Paul Rosen, who is an Olympic gold medal winner. Stay tuned here on TalkingSports.tv. Thanks, guys.
very good. Thank you.
Ladies and gentlemen, let's get ready to rumble!